Hi guys, today I want to talk to you about my top 5 myths surrounding exercise and rehab. Now, these myths are really common, and in fact at one point in my life I definitely believed and almost sort of advocated for these myths. And that is because there's so much information out there. If we're looking online, there are so many health and fitness influencers that are providing cookie cutter sort of blogs and information, and often it's completely false and it's not backed with science or research-based information. So today I'm going to go through 5 of these top myths that are really common, and you might hear these myths floating around with your friends and family, within the gym, and sometimes even from your doctor, because we all get it wrong at some point and research changes over time. So the first myth that I want to look at debunking is the idea that we need to be foam rolling our ITB to release tightness or stiffness. Now, the ITB, or the iliotibial band, runs from the outside of our hip down to the outside of our knee. It is a thick and very dense connective tissue that is non-contractile, so it's not like muscle. It doesn't contract and relax. Now, rolling out an ITB is the equivalent of trying to roll out a belt made of leather. It just doesn't work. And even if you're able to get some sort of stretch on that ITB, it's actually not going to last very long at all, and it's going to be very short-lived. It's going to go back to its normal state within a matter of minutes. So foam rolling is just like rolling out a leather belt. It's very ineffective, and it can also cause quite a lot of pain, so it's just not worth it. My best tip is to look at the other structures surrounding the ITB, specifically looking at the hip joint. Can we mobilize the hip, and can we look at getting more stretch and mobility through our hip flexors, our hip extensors, rather than focusing on the ITB? That's just not a connective tissue that likes to stretch. So that's one of the main tips that's really prevalent in health and fitness, especially looking at runners. Runners tend to get a lot of ITB pain, but rolling out that area just isn't the most effective way to help relieve some of that pain. The second myth is considering I need to rest because I'm in pain, or I need to rest my injury. Now, often when we're looking at musculoskeletal injuries, complete rest and immobility is the worst thing you can do for an injury. Looking at a lower back injury or lower back pain, for example, a really common piece of advice that you will be given with a lower back injury is to avoid load and avoid bending. Now, our backs are actually made to bend, and they're more resilient than what we give them credit for. Our back can go under quite a lot of load, and our back actually recovers better if we're placing smart and well-prescribed load, volume, and intensity over time. So when we're thinking about having lower back pain or a lower back injury, the worst thing we can often do for it is to avoid any sort of load or bending. So if we become very scared of bending and really afraid of movement, this is often going to increase that sensitization or that sort of sensitivity in the area, making rehab that much harder because you've really sort of tightened that area up. It's now become guarded, and your brain is now sort of afraid to move it. So the idea around complete rest when we're in an injury or when we're in pain is not often the best advice that can be given. We need to be really smart when we're thinking about loading up the area. We need to make sure that the load is correct and that we're doing things in a really smart way, but it doesn't mean we take those 5 steps backwards to completely nothing. Third common myth that you're probably thinking about more from a female perspective is that lifting weights is going to make you bulky. Completely untrue. If you look at the best bikini fitness competitors in the world, they're super lean, with no body fat and muscle, but you would never consider them bulky. And they lift weights 5 to 10 times a week. So they're not at risk of getting bulky despite so much weights that they're doing on a day in, day out basis. Now, becoming bulky is probably more of a problem with a calorie surplus and a body fat percentage. Lifting weights is actually the catalyst for positive body composition change. We're increasing our lean mass, and often this is going to help reduce body fat. That is because when we have more lean tissue, our metabolic rate increases and we tend to burn more calories at rest. So lifting weights is not generally the problem of becoming too bulky. Lifting weights is actually great for achieving a lean body or a healthy body composition. Now, the fourth myth I want to look at in a rehab space is the idea that deadlifts are bad for our back. Again, backs are really, really resilient. They're made to bend and they're made to move. As I've just spoken about, deadlifts or moving our back can be a great tool for looking at injury and pain, but they have to be in that smart, specific way that we've just spoken about. So that exercise prescription needs to be really sort of honed in to be looking at our load, our intensity, and our volume, but in no way is deadlifting bad for our back. Research shows that the relationship or the association between lifting and lower back pain is really not that strong at all. There's a lot of conflicting evidence, and so there's no strong correlation between bending and back pain. The problem lies mostly in deconditioning of the back, poor technique, or a lack of understanding. So we know that deadlifting is actually a great tool for rehabbing the back and making that whole area stronger in general. So the best thing about a deadlift is that it targets not just your back, but looking at your grip strength, your shoulders, through your shoulder blades, your glutes and your hamstrings. So it's a great whole body exercise, and the deadlift can be varied specific to the person. So a deadlift can be changed if we're thinking about pulling from a different height, changing the range in which the joints work in. We can change the way that we lift a weight if we're doing it with a barbell, a dumbbell, or a kettlebell, changing the weight distribution again. And we can even do deadlifts in a singular way. So we're looking at a single leg deadlift. So deadlifts are certainly a top tip for helping with a lower back injury. So please don't be afraid of them. It just comes down to specific loading that is really tailored and individual to your back. Now, my fifth and final myth that I wanted to debunk, I think it's really important, is the idea that my back is crumbling when a person is describing common osteoporosis or common age-related change in their spine. So when a doctor perhaps describes osteoporosis to a patient, a really common way of describing it is that, the back is like powder, the back is crumbling away, and that's just really not the case. So not only is this description going to place so much fear in a person, they're not going to move their back, it's going to then reduce their quality of life, reduce the amount of movement they're putting through their back, which is only going to make their condition worse. So a nice way that I like to consider osteoporosis or normal age-related changes within the spine is just like wrinkles on a face, okay? So as we age, it's really normal to get wrinkles, and it's not a major concern for most people. Similarly to our back, as we age, it's normal to see changes, and that's okay. It doesn't mean that your back is crumbling away. Your back is more resilient than we give it credit for. And research strongly shows that movement and resistance-based training, so weight-bearing exercises, is the best thing you can do for your back. It helps to reduce the risk of osteoporosis, it helps to build up bone mineral density, and it just increases your movement and your quality of life overall. So please don't agree or sort of think that your back is crumbling away if you've been given a diagnosis of osteoporosis. It's completely normal, and the best thing you can do is move and load that area appropriately, okay? So your back is not crumbling, it's just what happens as we age. We start to develop some normal changes within the spine. So they're my top 5 sort of myths that I really wanted to debunk or explain further when looking in an exercise and rehab setting. They're such common ideas that get floated around from person to person without any real sort of evidence or science to back these justifications. And it's okay if some of these myths sort of really contrasted with your biases or your beliefs. That's totally normal. It just means that we need to look further into the research and the science behind these ideas so that you can have a really good idea as to what's really going on with your body and what is the absolute best thing you can be doing for rehab or for exercise. Let me know what you think.